Now, one of my favourite big picture economists in this country over the past year has been Gigi of the University of New South Wales. I spoke to her earlier to get her preview of the budget. Gigi, thanks for joining us again. I want to look to the budget tonight. There's a lot we know about it already. For instance, we were looking at the largest ever budget deficit, something over $200 billion. Now, it's still going to be the largest ever budget deficit, perhaps around $160 billion. Should we be relieved or worried?
I mean, as I've said from the beginning with this whole COVID bailout system that we've had going for a year or so, it's not the size of the deficit per se or the debt that I'm worried about. It's much more what are we spending on? And what's been happening during this last year, as you know, is largely a kind of a treading water support system rather than investments into Australia's productive potential for the long run, including things like infrastructure and health and education. So that's the sort of thing, if we are going to spend a lot of money, that I'd like to see it spent on. Instead, we've had these handouts like JobKeeper, and so from my mind, it's not that we're really that far behind. In fact, we're doing quite well relative to other peer nations in terms of our net debt to GDP ratio, but it's just that we haven't got much to show for it now.
Well, that's the important part of this budget, isn't it? Because that money on JobKeeper and the like, that's money that's spent. I mean, that performed a social good, getting people through that period. But now it's about recovery. So wouldn't you be looking for a lot more of that spend to be going on productive infrastructure, on investments that are going to deliver economic growth and social good in the future?
That is exactly what I'm hoping for, Chris. And one of the most exciting items that I'm looking forward to seeing in this budget is something on childcare. So we know that the government has been accused of having a bit of a woman problem, is trying to somehow make it up to women. And I think the childcare policy, while it's not just about women, is definitely something that can be billed as support for women. And so what I'd like to see there is more than just the kinds of stroke of a pen measures, which are easy to do, but not necessarily going to fix the problem in the long run. For example, I'd love to see some supply side action where we maybe have some public-private partnerships in building new childcare facilities and fitting them out well to provide high-quality, accessible childcare rather than simply addressing problems with caps and the price side of things, because that's really what will end up growing that sector and growing Australia's potential in the future along with it, because, of course, childcare is a three-point winner for Australia. You create jobs, you liberate labour, and you invest in Australia's future through investing in our young children.
Yeah, it seems to be a political winner. And as you say, you get an economic benefit because you liberate labour, which is important. What about some of these other big spending items? We're expecting $18 billion or more in aged care. Again, an obvious social good there, an obvious political need. But this is baking in spending that will be there year after year in perpetuity. Is that a worry, or can it be done in a wise fashion?
Well, in aged care, as with other kinds of basic services like childcare, like health, I can see a limited role for ongoing government involvement, but with a private sector in a sort of competitive aspect as well. That's what we have here in Australia in the healthcare system, for example. We have a good national basic public healthcare system, and then we have private insurers who compete for the excess business. And so I think that model could be applied very well in both childcare and in aged care, actually. And what I'd like to see in that massive aged care budget, because you're right, it's very, very large, is a lot more effort towards big-scale architectural engineering protocol design that is user-friendly, takes user input in the design, and really caters for the needs of course, the baby boom generation, which is just about to enter those facilities. And if we don't have a major upgrade in how we think about aged care and how we then design our aged care systems, we're going to have a human catastrophe on our hands yet again.
Doesn't that mean we need to do something that's very politically unpopular, and that is make sure that the savings or the assets of the elderly, if they have them, pay for their aged care rather than the government?
So in the US, which is my country of origin, we have exactly that sort of system whereby there are savings vehicles provided expressly for the use in retirement. And in fact, my mother had one just like this. It was called long-term care insurance. And so if you do have enough money to buy into that, then, for example, from your extremely generous superannuation budget, because Australian super balances amongst particular classes of people are very, very high relative to international standards, then you could, for example, buy into a scheme like that. And then that could help to fund your own aged care along with some government assistance if you are qualified for that. But yes, indeed, I feel that there is such a wealth disparity, particularly a large concentration of wealth amongst older people who have had really good jobs in Australia and have benefited from our very generous superannuation system, that some way of tapping that wealth to fund their aged care would be appropriate while providing a baseline support system for other people.
We will see whether there is the imagination and the political coverage to deliver in that area. Somehow, I doubt it though. Thanks so much for joining us, Gigi.